Hello, welcome to pathophysiology. Acidity and adherence to reach the small intestine, vibrio taken by mouth must pass through the stomach, and acid region inimical to their survival. We have already seen that persons with hypochlorhydria or those we have undergone gastroectomy go down more readily with cholera when exposed to infection than normal persons do. And in the experimental field it has been shown that a dose of 10 to the power 11 vibrio is needed to induce infection in human volunteers, but only 10 to the power 6 vibrio when the volunteers first swallow 2 grams of sodium bicarbohydrate 34 on arriving in the more alkaline duodenum and jejunum. The vibrios multiply, but this multiplication by itself does not lead to an outpouring of fluid into the small intestine, nor cause any diarrhea in the patient. The lumen of the intestine may teem with vibrio cholera, yet there is no cholera. The vibrio must first adhere penetrate the overlying layer of mucus, and we have already seen that the motility of the vibrio plus perhaps the secretion of mucinase may help it to get through. An adherence factor must then attach the vibrio to the mucosal surface 32. It is nature is not clear, but that there must be some such factor is shown by a study of immune mechanisms. A small amount of anti-zero serum introduced into the lumen of the intestine prevents this adherence, and vibrio are seen free in the lumen of the intestine and not concentrated on the mucosal surface as they are in active cholera. When immunity is induced by cholera vaccine, bacterial vaccine, not a toxoid, this some effect is seen. No antitoxin is induced. The protection antibody is antibacterial only. It does not kill nor abscines the organisms, but prevents the adherence. And the result is that they are removed from the body by normal peristalsis without having been able to set up any toxic reaction in the cells of the mucosa. So adhesion is essential for cholera. Binding to mucosa adhesion is apparently reversible through adherent organisms are not removed by washing. Binding is something very different. Vibrio cholera in the intestinal canal is essential outside the body. It must bind to the mucus before it can exert its toxic effect. Cholera introtoxin is a protein molecule of molecular. It can weight 84,000 daltons. It consists of two different types of subunit, a light or H type of 8,000 daltons and a heavy of H type of 28,000 daltons. One unit contains 6L and 1H subunits. The L units are concerned with binding. The H unit mediates the toxic effect. The introtoxin is sometimes referred to as choleragen. Vibrio cholera produces another protein molecule, chloragenoid. This has a molecular weight of 56,000 Daltons contains 6 L units but no H unit and has therefore no biological activity. It might have some immunizing property for if it provoked an antitoxin which prevented binding to it would therapy prevent only toxic reaction.